20 weird signs of kidney diseases most people will miss. Please watch carefully because this just might be the most life-changing video for your health this year. You could be living with kidney failure right now and feel completely normal. No pain, no strange urine, no dramatic symptoms. Just fatigue, poor sleep, maybe some itchy skin. You eat less than usual. That could be stress, right? You wake up twice a night to pee. Probably just normal aging, you tell yourself. And that constant fatigue? You chalk it up to poor sleep, a demanding job, or just the chaos of everyday life. But what if it's none of that? What if your kidneys are quietly shutting down and you have no idea? Remember that kidney failure doesn't scream. It whispers. Most people don't notice anything wrong until it's far too late, as the signs are subtle and easy to ignore. In this video, you'll learn everything you need to know to detect kidney diseases. Catching the signs just one day sooner could mean saving your kidneys one day sooner, and that could make all the difference. We'll walk you through the early signs, the strange skin symptoms, and the subtle red flags that most people ignore until it's too late. You'll also learn about the groups most at risk for kidney disease, so you'll know if you or someone close to you should be paying extra attention. And just as importantly, we'll break down the essential tests doctors use to detect kidney issues early, so you'll know exactly what to watch for before it's too late. And by late, we mean getting to the final stage, or stage 5, of chronic kidney disease, or CKD for short. At this point, your kidneys are severely damaged and can no longer do their vital work, like filtering waste from your blood or balancing fluids in your body. It's a tough diagnosis, but understanding it is the first step to managing it. Just so you know, everything in this video is carefully researched and put together by real people, double-checked by actual experts, and kept bias-free. Let's first explore the 4 main ways to tackle this condition. Options to treat end-stage kidney disease, or ESKD for short. 1. Medications. Medications are a cornerstone for managing kidney disease, especially when it reaches a serious stage like ESKD. They help ease symptoms and keep complications in check, making day-to-day life more comfortable. For instance, some medications keep your blood pressure steady, which is so important for protecting your kidneys. Others, called diuretics, help you urinate more to clear out extra fluid that can build up in your body. There are also erythropoiesis-stimulating agents to help your body make more red blood cells to deal with anemia. And for those with diabetes, anti-hyperglycemic drugs help keep levels steady. Your doctor will work with you to find the right combination to help you feel your best. 2. Kidney transplant. For many, a kidney transplant is the best hope for managing severe kidney disease. It's not an easy path. 100,000 Americans are on transplant waiting lists, with 87% of those awaiting kidneys. So, what does a transplant involve? It means replacing your damaged kidney with a healthy one from a donor, freeing you from the need for dialysis. This can lead to a longer life and a better quality of life, with kidney transplants linked to fewer heart-related problems compared to dialysis. However, it involves finding a matching donor, undergoing surgery, and taking lifelong medications to prevent your body from rejecting the new kidney. Now that we speak about donor match, it's important to bring up a disturbing reality in China where organs are harvested illegally and without consent to profit from the desperate need for transplants among many people. Chinese hospitals claim they can find a matching organ within weeks, days, or even hours, while in other countries, it takes years. This means these hospitals have a large number of living donors ready to be used at any moment. The majority of these organ donors are prisoners of conscience, particularly practitioners of Falun Gong, a spiritual practice with a mind-body approach. In 1999, with Falun Gong practitioners exceeding party members in number, the CCP found Falun Gong's emphasis on truthfulness, compassion, and tolerance, and the belief in the divine, a threat to its atheist regime, which maintained power through control and suppressing faith. A nationwide crackdown was launched, with state-controlled media defaming Falun Gong, undermining public support for the practice, and police forces arresting and detaining practitioners illegally. Reports reveal cruel forms of torture in prisons, even sexual abuse, all to force people to give up their faith. One of the most serious accusations, backed by multiple investigations, is that Falun Gong practitioners have been killed for their healthy organs, fueling a massive transplant industry worth around $1 billion per year. The persecution of Falun Gong sadly continues to this day and has even spread beyond China. Reports suggest that funds have been used to influence individuals, groups, and media in the US to discredit Falun Gong. Recently, a YouTuber with 4 million subscribers and 3 billion views revealed this manipulation campaign in an interview.
China started hiring YouTubers. They offered, I'm pretty sure I got offered this at some point. I got an email where they were like, we'll give you $200 to post this video to your YouTube channel. And then I looked at the video and it was a guy being like, these really weird people, Falun Gong, like, what's this about? And then it was like a mini doc that was like 5 to 10 minutes long from some white dude complaining about this group. And I'm like, I ain't posting that to my channel. What is this? But a lot of people were like, $200, I'll take it.
This appears to be part of a broader campaign to turn the American and global public against the practice and justify the inhumane persecution in China over the past 26 years. In spite of all oppression, Falun Gong is now practiced by over 100 million people in over 100 countries worldwide. Now, if you're thinking about getting an organ transplant abroad, do not go to China. This way, you can avoid unknowingly supporting any inhumane crimes. There is so much more to this brutal story, and you can find more details and evidence in our description box. 3. Dialysis. When kidney disease progresses to its final stage, even with healthy habits and medications, dialysis often becomes a necessary step. Dialysis is needed in the final stage of kidney disease when your kidneys can no longer clean waste from your blood effectively. It acts as a substitute for your kidneys, using artificial methods to filter waste from your blood. Dialysis is performed in several different ways. Hemodialysis, one type of dialysis, uses a machine to clean waste from your blood outside your body. This usually means visiting a clinic a few times a week. Another option is peritoneal dialysis, where a special fluid is placed in your belly through a tube, and your body's own membrane filters out the waste. Peritoneal dialysis gives you more comfort and freedom, letting you do it at home overnight without costly machines. Both options help keep you going, and your doctor can guide you to the one that fits your life best. 4. Lifestyle changes. Patients with ESKD can greatly benefit from diet and lifestyle changes. Eating a kidney-friendly diet is key to avoiding malnutrition, reducing waste buildup, slowing kidney disease, and preventing complications. Your doctor will tailor advice to your needs, so talk to them about how much protein, salt, potassium, fluids, and phosphate you should have for your kidney condition. Staying active regularly can boost the health of people with kidney disease. Regular exercise can improve your blood pressure, energy levels, heart health, muscle strength, and more. Another big step is quitting smoking. Stopping smoking can really help your health, as smokers face a higher chance of developing severe kidney disease than non-smokers. These changes aren't always easy, but they can make a real difference in how you feel. Overall, treatment for ESKD and CKD is costly. In 2020, Medicare spent $75 billion on people over 66 with kidney disease and $50.8 billion on those with severe kidney failure. Beyond the financial burden, this condition can take a toll on your body and spirit. People with kidney failure often don't notice any changes in their kidneys or urine. You may not notice any changes in how much, what color, or how your urine smells. Some folks might wake up more at night to use the bathroom, but that's not a clear sign of kidney trouble. That's why knowing the signs is so important. In this section, we'll walk you through 7 of the most common symptoms of severe kidney disease so you can feel more confident spotting them and taking action. 8 warning signs of kidney failure. 8. Fatigue. Feeling constantly tired is something many people with serious kidney disease go through. When your kidneys aren't working well, they can't clear out the toxins and waste that buildup in your blood, leaving you drained. Your kidneys also produce less of a hormone called erythropoietin, which helps your body make red blood cells. When your body makes fewer red blood cells, it leads to anemia, making you feel even more exhausted. If you have kidney disease, along with conditions like diabetes, high blood pressure, a past heart attack, depression, or trouble sleeping, you might feel extra worn out. Everyday tasks, like climbing stairs or even getting through your morning routine, can start to feel like a chore. The good news? People with kidney failure who stay active often notice their tiredness gets better. Gentle movement, like a short walk or stretching, can make a real difference. Some doctors prescribe medications called erythropoiesis-stimulating agents to help with anemia and severe kidney disease, though their ability to ease tiredness is still debated. Always check with your doctor to find what works best for you. 7. Muscle cramps. Painful muscle cramps often trouble those with advanced kidney disease. These sudden, tight spasms, especially in your legs, can catch you off guard. They happen when the balance of electrolytes in your blood, like calcium, potassium, or magnesium, gets out of whack. Leg cramps often happen during dialysis when your blood becomes too alkaline, a condition called alkalosis. When your blood's alkalinity throws off your electrolyte balance, it can trigger muscle cramps. After dialysis, low magnesium levels in your blood, known as hypomagnesemia, can also cause muscle cramps. Sometimes, potassium levels drop too low, a condition called hypokalemia, which can come from vomiting, diarrhea, certain medications, or dialysis itself. When your potassium levels drop too low, it can also bring on painful muscle cramps. The good news is, there are ways to ease this discomfort. Adding magnesium to the dialysis fluid can help ease muscle cramps for those with severe kidney disease. Your doctor might also tweak your medications to keep your electrolytes in balance, helping to keep those cramps at bay. And hey, if this feels helpful so far, let us know you're out there by tapping that like button. It tells us to keep making content just like this. Now you might be thinking, I don't have cramps, so I must be fine. But here's the thing. Kidney disease doesn't always start with visible symptoms. The next signs? They're even more subtle and often mistaken for something else. 6. Loss of appetite and eating less. It's not uncommon to lose your appetite when dealing with advanced kidney disease. When toxins and waste build up in your blood, you might find yourself less interested in food. This can start even in the earlier stages of kidney disease, but as things progress, you may notice you're eating even less. Things like mouth or stomach issues, dialysis, or feeling down can also make you less hungry when you have kidney disease. If you're dealing with both diabetes and kidney disease, you're more likely to lose your appetite. Over time, diabetes can affect the nerves that control how your stomach empties, a condition called diabetic gastroparesis. This can make you feel full even when you haven't eaten much, because food moves through your stomach more slowly. Eating might even lead to nausea, vomiting, or discomfort in your belly. Not getting enough nutrition can make kidney disease harder to manage, so it's really important to follow your kidney specialist's advice on what to eat. Your doctor might suggest medications like magistral acetate to help boost your appetite. If you're taking these, your doctor will keep an eye on side effects like fluid buildup, weight gain, or high blood sugar to keep you safe. 5. Itching. Persistent itching, often called pruritus, is something many people with severe kidney disease experience. More than 40% of those on dialysis deal with this frustrating sensation, and for some, it's bad enough to keep them up at night. The exact reasons for itching aren't fully clear, but it's likely due to more inflammatory substances and immune cells in your blood, an imbalance in opioid receptors, and a buildup of toxins and electrolytes. To help with itching, your doctor might adjust your dialysis settings or suggest treatments like gabapentin, pregabalin, phototherapy, or medications that target opioid receptors. These options can make a big difference, helping you feel more comfortable in your own skin. Now that might sound like a small problem, just a bit of itching. But up next are symptoms that affect your breathing, memory, and even your brain. If you felt off lately, pay close attention. 4. Shortness of breath. Feeling like you can't catch your breath can be frightening. This sensation, known as dyspnea, is a serious sign of advanced kidney disease and can have several causes. When your kidneys aren't working well, imbalances in fluid, electrolytes, or proteins can lead to extra water building up in your lungs, a condition called pulmonary edema, which makes breathing feel harder. Scarring or high blood pressure in the lungs can also contribute to this struggle. Anemia, which often comes with kidney disease, can make it hard to breathe because your body isn't getting enough oxygen. Another cause is when you're malnourished and inflammation is high with kidney disease. Toxins build up in your blood, causing a condition called protein energy wasting syndrome. This can weaken your muscles, including those you use to breathe, making every breath feel like more effort. The best approach is to work with your doctor to manage these causes, often with respiratory support or treatments tailored to what's causing your shortness of breath. 3. Memory loss, confusion, dementia. When your kidneys are struggling with severe disease, you might notice changes in how your mind works. It could be trouble focusing, forgetting things, finding it hard to learn new tasks, making decisions, or even feeling confused. In some cases, these changes can feel like dementia. These challenges happen because waste products build up in your blood, which can cloud your thinking and affect how your brain functions. Damage to blood vessels in the brain from low oxygen levels can also play a role. Feeling low on energy due to anemia, struggling with depression, or having trouble sleeping can also affect how your brain works. The good news is there are ways to help. Keeping your blood pressure well managed can lower the chances of mild memory or thinking problems. People who get a kidney transplant often find their memory improves after the surgery. If you're curious about the research behind this, we've included a link to the studies in our description box. 2. Urine-like breath, abnormal taste. Sometimes, severe kidney disease can cause your breath to have a urine-like smell, a condition called uremic fever. This happens when your kidneys can't filter waste properly, letting it build up in your blood. High levels of ammonia in your blood can cause a distinct urine-like smell on your breath. You might also notice an odd or metallic taste in your mouth, known as dysgeusia. This can come from changes in the amount, flow, or acidity of your saliva. Imbalances in your body's fluids, electrolytes, or a buildup of toxins can also lead to an unusual or metallic taste in your mouth. A simple way to tackle this is by using a bicarbonate mouthwash, which can help get rid of the unpleasant taste caused by waste buildup in your body. Poor oral hygiene is common for those with severe kidney disease, so it's a good idea to visit your dentist to check on your mouth's health. A quick dental checkup can go a long way. 1. Skin changes. Your skin might tell a story about what's happening inside your body when you have severe kidney disease. About 40% of people with this condition notice their skin looking pale or discolored, often because of anemia. Others might see darker patches, called hyperpigmentation, due to changes in hormone levels. If you're noticing darker patches on your skin, applying sunscreen can help keep it from getting worse. The buildup of substances that give urine its yellow color can also give your skin a yellowish tint. Very dry skin, known as xerosis, is another common issue, though we don't fully understand why it happens. It's likely because the glands in your skin that produce oil and sweat aren't working as well, leaving your skin dehydrated. Dry skin can be eased by washing your hands, showering, or bathing less often. Using moisturizing lotions and avoiding fabrics that irritate your skin can also help. If your skin changes feel overwhelming, a dermatologist can offer tailored advice to make you feel more comfortable and confident. If any of these signs sound familiar, don't wait. Because by the time symptoms show up, your kidneys could already be in serious trouble. Don't forget that the best way to fight CKD is to prevent it from happening in the first place. How? By recognizing the early signs. In its early stages, CKD often stays silent, showing no obvious symptoms. But with lab tests, catching kidney disease early is entirely possible. We'll cover those tests soon, but for now, let's focus on the early clues you might notice at home or with a quick glance. 5 early signs of kidney damage you must not ignore. 1. Foamy urine. You're about to flush the toilet when you notice something odd. The water is full of foam, like frothy beer or whipped egg whites, and it doesn't go away quickly. This could be your kidneys trying to tell you something. Foamy urine shows up as layers of small to medium bubbles that stick around. It's easy to brush off. Who spends time staring at their urine? But there's no need to feel shy about it. Your body's talking to you, and listening is a smart move. Normal urine might have a few large bubbles that vanish fast, caused by the flow or natural substances in your urine. But when it's foamy, with lots of small bubbles lingering like latte froth, that's a different story. In CKD, foamy urine often comes from proteinuria, where proteins like albumin leak into your urine because your kidney's tiny filters are damaged. Remember, proteins normally stay in your bloodstream and aren't supposed to be in your urine. If ignored for years, this protein leak could lead to dialysis. A quick home check can help. Urinate into a clear container and watch. If the foam stays after 3 minutes, tell your doctor. Still, only about 1 in 3 people with foamy urine has unusual protein levels in their urine, so don't panic. Just stay curious. 2. Nocturia, or nighttime urination. You're waking up 2 or 3 times a night to use the bathroom, and it's not because of that morning coffee. Something's going on with your kidneys. Nocturia, the medical term for frequent nighttime urination, often ties to producing too much urine, a condition called polyuria that can happen with CKD. When your kidneys struggle to balance salt and water, you might need to go more at night or even all day. What's normal? Younger folks usually sleep through the night without a bathroom trip. For those over 65, 1 trip might be typical. But waking up twice or more, especially if it's new, is worth noticing. This interrupted sleep isn't merely frustrating. It has a significant impact on your overall well-being. While you're working on the root cause, here's a helpful suggestion. Place nightlights along the hallway to your bathroom to avoid falls during those nighttime trips. Age-related shifts in circadian rhythms, your body's internal clock, can also play a role in nocturia. Other potential causes include diabetes, prostate enlargement in men, pregnancy, urinary tract infections, and specific medications. However, if it's accompanied by other kidney-related symptoms, it may require more attention. Studies indicate that as kidney function declines, nocturia becomes more common with an increased frequency of nighttime bathroom visits. A 2023 study showed that people who wake up at night to urinate had slightly lower kidney function, measured by eGFR, than those who don't. 3. Blood in the urine, or hematuria. You're in the bathroom when you freeze. Your urine looks pink, or maybe it's dark like tea. It's unsettling, but it's your body waving a red flag that needs attention. Hematuria means blood in your urine, and it can show up in early kidney disease. Sometimes it's visible, called gross hematuria, or only seen under a microscope, known as microscopic hematuria. Visible blood might look bright red, pink, or cola-colored, depending on how much blood is there and how long it's been in your system. Instead of worrying, let this push you to see your doctor quickly. Many causes are treatable if caught early. Microscopic blood, which doesn't change urine color, is usually found through testing. Urine dipstick tests or microscopic exams can confirm blood. Studies also found that blood in the urine became more common as kidney function, measured by eGFR, dropped. In moderate CKD, this can signal a higher risk of the disease worsening or even death within 2 years, making it a key warning sign. 4. Decreased urination. You notice you've only used the bathroom twice today, when you'd normally go 5 or 6 times. You're drinking plenty, so what's going on? Decreased urine output, or oliguria, can sometimes point to CKD, though it's more common when an acute kidney injury, or AKI for short, happens on top of CKD. Normally, adults produce 1 to 2 liters of urine daily, meaning about 5 to 6 bathroom trips, depending on how much you drink. A big drop from your usual pattern is what matters. This might happen if a blockage in your urinary tract, like from kidney stones, worsens CKD and leads to urine retention, where you barely urinate. Things like severe dehydration, shock, or low blood flow to the kidneys can also cause this. You might also notice swelling in your ankles, hands, or around your eyes as your body holds onto fluid. Pay attention. Do you feel like your bladder is full, but you can't go? Or is your urine volume much lower despite drinking normally? 5. Flank pain. There's a nagging ache in your side that doesn't feel like a pulled muscle from gardening or exercise. It's deeper, sometimes with a touch of nausea, and it's coming from the area between your lower ribs and hip, near your spine. This could be your kidneys asking for help. People with kidney disease are much more likely to feel pain in their sides than others, either from the kidneys themselves or related issues. Unlike regular back pain that might ease with a stretch, kidney pain stays steady no matter how you move. To find it, place your hands on your hips and slide them up toward your back until you feel your lower ribs. The pain is usually just below, deeper than typical back pain. Chronic flank pain is a hallmark of polycystic kidney disease, where fluid-filled cysts grow in the kidneys, but it can also come from infections, inflammation, tumors, or blood vessel issues in the kidneys. Blockages in your urinary tract, like kidney stones, can also cause CKD and flank pain, which might spread to your groin or belly and range from mild to sharp. Flank pain doesn't always mean kidney disease, but when it's paired with other signs we've covered, it's a piece of the puzzle worth checking. Now that you're familiar with these early signs of kidney disease, let's look at what happens as it moves forward. Before it reaches severe stages, your skin might start to show changes, especially if your kidneys have been struggling for a while. Watch for these skin clues, and we'll share some practical tips to keep your skin healthy and comfortable. 8 weird skin signs of kidney damage you must not ignore. 1. Itchy skin, pruritus. Picture this. It's 2 a.m. on a Tuesday. You're not awake because of a noisy neighbor or a bad dream. You're wide awake because of an itch so relentless, it feels like an army of tiny ants marching in formation under your skin. You've tried every position, every sheet, every distraction technique. But the itch persists. This isn't your garden variety mosquito bite or dry winter skin itch. This is uremic pruritus, and it's one of the most common skin symptoms when your kidneys are in trouble, showing up in as many as 40% of people with end-stage renal disease, or ESRD for short. For many, it's the first red flag that something's seriously wrong. When your kidneys can't effectively filter out waste products, urea builds up in your blood like sediment in a clogged drain. This accumulation leads directly to that unbearable itching sensation. It can occur anywhere on the body, but often strikes your back, legs, and arms. During the day, distraction helps. But at night, sweat makes it worse. Dry skin intensifies it. Heat turns it into absolute torture. What starts as just scratching quickly becomes something far more serious. Constant scratching creates scrapes and open wounds. Your skin begins to change, thickening, turning leathery. Raised bumps called prurigo nodularis dot your arms and legs like a topographical map of discomfort. Once your skin barrier breaks down, you've essentially opened the door for bacteria. What began as an itch can spiral into dangerous infections. And hey, if this feels helpful so far, let us know you're out there by tapping that like button. It tells us to keep making content just like this. 2. Swelling. Your wedding ring stopped sliding over your knuckle 3 weeks ago. Those leather shoes you've worn for years now feel like torture devices by mid-afternoon. When you press your thumb into your lower leg and hold it there for a few seconds, the dent remains like a fingerprint in wet sand. Your kidneys normally function as your body's personal bouncer, escorting excess water and salt off the premises. When kidney function declines, these unwanted guests overstay their welcome, setting up camp in your tissues. The result? Swelling, or as doctors call it, edema, particularly in your hands, feet, ankles, and face. The distribution tells its own story. Gravity plays a role, so swelling typically starts in your lower extremities. Stand or sit for long periods, and your ankles become the collection point. Lie down, and the fluid shifts upward, sometimes creating a startling morning face you barely recognize in the mirror. Try this simple test. Press your thumb into your lower leg and hold for a few seconds. If it leaves an indentation, what doctors call pitting edema, it's time to check your kidney function. 3. Changes in skin color. Your mirror reflects a stranger these days. That healthy flush in your cheeks has been replaced by something you can't quite name. Maybe it's a yellowish tint that foundation can't mask, or a grayish pallor that makes your friends ask if you're feeling all right. When your kidneys struggle to filter waste, your blood becomes a repository for toxins that should have been eliminated. These accumulated wastes literally change your skin's appearance from the inside out. The yellow or gray cast isn't just cosmetic. It's a chemical transformation visible to anyone paying attention. But color changes don't stop there. You might notice hyperpigmentation, dark brown patches emerging across your skin as melanin builds up in places it shouldn't. If you're looking paler than usual, that's often anemia talking, a frequent companion to kidney disease. Then there's something that sounds like it belongs in a Gothic novel: uremic frost. After particularly heavy sweating, some kidney patients develop a white, powdery residue on their skin. It's like your body is trying to sweat out the crystallized toxins your kidneys can't filter. And note that excessive scratching can also change your skin's color and texture. 4. Dry skin or xerosis. Your moisturizer has become your most constant companion, yet your skin still feels like old parchment. You apply lotion after every shower, keep tubes in your car, your purse, your desk, but moisturizer seems to evaporate the moment you apply it. Simple movements stretch your skin to the point it might crack and bleed. Dry skin affects between 50 to 80% of dialysis patients, making it one of the most common symptoms of kidney disease. When kidneys fail, multiple body systems cascade into dysfunction. Some people don't drink enough water, ironic, since too much fluid can be dangerous for kidney patients. Others find their sweat glands barely function anymore. Long-term diuretic use strips away what little moisture remains. And high vitamin A levels, which sometimes result from kidney issues, can turn skin into a desert. What starts as typical dry skin morphs into something more serious. Your skin becomes fragile, prone to cracking with the slightest movement. Simple actions, reaching for a cup, turning a doorknob, can split your skin open. The real danger? These cracks become a highway for bacteria. What starts as discomfort can quickly escalate to serious infection. Curious about the science behind it all? We've linked the studies that support everything we've shared. You'll find them down in the description box. 5. Rashes. These aren't the rashes you'd expect from new laundry detergent or a spring walk through poison ivy. People with advanced kidney damage develop something called acquired perforating dermatosis, a mouthful for what looks like small, pigmented, itchy bumps with scaly centers. These bumps can usually be found on your arms and legs first. Sometimes they venture onto your trunk, scalp, or buttocks. What makes them particularly frustrating isn't just their appearance, it's their stubborn persistence. Just as some bumps begin to heal, newcomers emerge nearby, creating what dermatologists describe as lesions in multiple stages of healing. Eventually, they can join together into larger patches. Here's where the cruelty intensifies. While these rashes itch terribly, scratching provides only momentary relief followed by increased irritation. The bumps can break open with scratching, leading to scars and more problems down the line. 6. Blisters. They appear without warning. Fluid-filled sacs that emerge on your skin, usually choosing the most visible spots. The backs of your hands, your forearms, occasionally making surprise appearances on your feet or face. These aren't the friction blisters from ill-fitting shoes or burn blisters from touching a hot pan. These are systemic blisters, a sign your body's balance has shifted. The size also varies. Some blisters remain barely noticeable, while others grow impossible to ignore, stretching skin taut like tiny water balloons. They may be accompanied by other symptoms, such as pain, redness, and swelling. Kidney damage is just one potential cause of blisters. Blisters can be caused by infections, medications, poor diet, and heavy alcohol intake. What makes kidney-related blisters particularly troublesome is their aftermath. Unlike simple burns that heal with minimal scarring, these blisters often leave permanent calling cards. As they heal, they frequently create scars and skin discoloration. 7. Calcium deposits. This is where things get serious and scary. Calciphylaxis sounds like a science fiction term, but it's a real condition that strikes up to 4% of dialysis patients, representing one of the most severe skin manifestations of kidney disease. It begins with painful pink or purple bumps or plaques, typically on your abdomen, buttocks, or legs. With time, these bumps transform into deep, excruciating ulcers covered with black crusts. The risk factors create a perfect storm: high blood calcium levels, long-term dialysis, obesity, certain medications that affect calcium metabolism. The prognosis varies dramatically depending on early intervention. Caught early, aggressive treatment can halt progression. Delayed diagnosis often leads to limb amputation or death. A related but milder condition, calcinosis cutis, presents differently. Here, calcium deposits form firm white nodules near joints. Sometimes these calcium collections break through the skin's surface, releasing a chalky white discharge. While generally not painful, when these deposits form in fingers or toes, every movement becomes a reminder. 8. Hair and nail disorders. Your bathroom mirror tells a story you'd rather not read. Your hairbrush collects clumps that seem to multiply daily. Your nails tell a similar story: white horizontal bands, color changes, strange ridges. These might seem like vanity concerns, but they can be important indicators your kidneys need help. Hair loss, medically called alopecia, can crush your self-esteem. But the causes run deep. Severe nutritional deficiencies in iron and zinc, hormone imbalances as your kidneys struggle to regulate multiple systems, and medications, including some blood pressure medications and immunosuppressants that fight kidney disease but sacrifice your hair in the process. And dialysis treatments can strip hair of its natural oils, leaving it dry, brittle, and prone to breakage. Nail changes often appear earlier than hair loss, making them important early warning signs. Lindsay's nails show brown at the tips and white or pink at the base, a distinctive half-and-half pattern. Me's lines appear as single or multiple white bands crossing your nails horizontally, often corresponding to episodes of severe illness. Sometimes one will see splinter hemorrhages, tiny red or brown lines that look like actual splinters under your nails. They're caused by small blood clots, damaging the delicate capillaries underneath. In one study of 100 kidney disease patients, nail changes appeared in 60%. Another study found hair, nail, and mucosal disorders in 23 to 45% of dialysis patients. When to seek help. We've covered 8 significant skin signals, but here's the crucial question. How do you know when it's time to see a doctor? Some symptoms scream for immediate attention. Calciphylaxis demands emergency intervention. Other signs whisper warnings that gradually crescendo into emergencies. If you're over 60 with existing conditions like high blood pressure, diabetes, or obesity, even seemingly ordinary skin changes deserve attention. Your primary care physician should typically be your first stop. Blood work and urinalysis will either confirm your concerns or provide reassurance. You must communicate well with your doctor, who can explain your condition and how to prevent further skin changes. For severe or persistent skin symptoms, especially those affecting quality of life, you should see a dermatologist or skin doctor who can collaborate with your nephrologist or kidney doctor. What you can do. Post-diagnosis, medication might be necessary, but it's far from the complete solution. Your daily choices profoundly impact both your kidney function and skin health. Dietary modifications form the foundation. A kidney-friendly diet means monitoring sodium, protein, phosphate, and calcium content. Work with a renal nutritionist to develop satisfying meal plans that naturally align with kidney-friendly requirements. Plus, try to quit smoking and limit or avoid alcohol consumption. Hydration becomes surprisingly complex with kidney disease. The old 8 glasses a day advice doesn't apply when your kidneys can't process fluids efficiently. If you have kidney issues, especially if you are on dialysis, overhydration can lead to fluid buildup. To manage thirst when restricting fluids, eat pieces of frozen fruit, drink small sips, or rinse your mouth with mouthwash. Work with your healthcare provider to establish personalized fluid goals. Skin care takes on new significance. Daily moisturizing isn't optional, it's a medical necessity. Choose fragrance-free, hypoallergenic products. Avoid using harsh soaps and skincare products that can irritate your skin. Emollients containing ingredients like salicylic acid or urea can help penetrate thicker, compromised skin. Modify bathing habits. Hot water strips essential oils from already fragile skin. Keep showers short, use lukewarm water, and pat rather than rub skin dry. Immediately apply moisturizer to lock in moisture. Sun protection becomes non-negotiable. Choose broad-spectrum sunscreens with SPF 30 minimum. Use it even on cloudy days and reapply it throughout the day. Physical sunblocks containing zinc oxide or titanium dioxide often work better for sensitive kidney skin. Plus, wear protective clothing. Choose loose-fitting, comfortable clothing made from natural fibers like cotton. This allows your skin to breathe. And never underestimate the power of regular checkups. They're essential for monitoring kidney function and catching new problems early. Use these appointments to discuss any changes or concerns. That's it. This wraps up our list of 8 skin signs that could point to kidney trouble. You've now learned all 20 surprising signs of kidney disease, from early clues to severe stages. If any of these sound familiar, what can you do to protect your kidneys and slow the disease? First, are you at high risk for kidney disease? Knowing your risk is key. Let's explore the 10 groups most likely to face kidney trouble, ranked from highest to lowest. This isn't just about numbers. It's about safeguarding your health and those you love. If you're on this list, we'll share simple, practical steps to protect your kidneys at the end of this video. Who is most at risk for kidney disease? 10 most vulnerable groups. 1. People over 60. While young to middle-aged people, ages 20 to 60, are not usually considered high risk for CKD, the story changes greatly after age 60. A 2014 study published in the Journal of Clinical Practice revealed that about 11% of U.S. adults have CKD, and the rate is much higher in those over 60, around 39.4%. In a study in 2010, only about 2.7% of people aged 18 to 29 had kidney abnormalities, but nearly 58% of people in their 60s do. But why are older adults more vulnerable? It's largely because our kidneys naturally change with age. They lose mass, they have fewer functional filtering units, called nephrons, and their surface becomes rough. Also, blood vessels supplying them, or arteries, become hardened and narrower. With these changes, kidneys lose their function, filtering blood more slowly. As a result, blood becomes more acidic, which can contribute to dehydration and metabolic and fluid imbalances. All are not good for kidney health. Plus, oxidative stress, inflammation, and fibrosis are common in aging and play a key role in CKD development. In short, kidney health is particularly worsened by aging, and conditions like high blood pressure, diabetes, and obesity can speed up this process. For our senior viewers, the key to keeping your kidneys young is staying well hydrated and eating more antioxidant-rich and natural foods, including veggies, low-sugar fruits, white meat, and fatty fish. While some medication may help, research shows that doing exercises to improve circulation and controlling sodium intake are the real stars when it comes to slowing kidney aging. 2. People with diabetes. Diabetes tops our list as the leading cause of kidney issues. It accounts for approximately 40% of newly diagnosed CKD. In other words, about 1 in 3 adults with diabetes develops kidney disease. The link is simple. Consistently high blood sugar from diabetes causes inflammation and damages blood vessels in your kidneys over time. So, the longer someone has diabetes, or the more poorly they control blood sugar levels, the higher their risk. About 8% of newly diagnosed patients with type 2 diabetes already show signs of kidney disease through protein in their urine, also known as proteinuria. Type 2 diabetes can be more aggressive than type 1 in damaging kidneys, particularly in young people. A 2012 Canadian study that followed 342 young people with diabetes found that those with type 2 diabetes were 4 times more likely to develop kidney failure compared to those with type 1 diabetes. For people with type 2 diabetes, the risk of kidney damage increases with age and other health conditions. If you have eye problems from diabetes, also known as diabetic retinopathy, it could mean your kidneys are at a particularly higher risk too. The good news? If you have diabetes, you can reduce your risk through a careful approach. Tight blood sugar control, regular exercise, at least 150 minutes weekly, and a balanced diet low in sodium and processed foods. The goal is to keep the A1C below 7% to protect your kidneys. The A1C test shows your average blood sugar level over the past 3 months, which is different from the daily blood sugar checks you might do at home. Regular screening, or at least annually, is your best defense. Some medications like ACE inhibitors or SGLT2 inhibitors have shown promising results in protecting the kidneys in those with diabetes. And note that even pre-diabetes can start affecting your kidneys, so early intervention is key. 3. Hypertension patients. When blood pressure remains high, also known as hypertension, it damages the small blood vessels inside your kidneys, impairing their ability to filter waste from your blood and causing proteinuria. Studies reveal that hypertension is responsible for 27% of all cases of end-stage renal disease, or ESRD for short, in the U.S. People with uncontrolled hypertension, particularly those who've had high blood pressure for many years, are at a higher risk. Note that it usually takes about 10 years of uncontrolled hypertension before significant kidney damage occurs. This is actually good news. It gives people with hypertension a window of opportunity to manage their condition. Try to keep your blood pressure below 130 over 80 millimeters of mercury. Regular monitoring, at least weekly, and annual kidney function tests are essential parts of your protection strategy. Remember, while hypertension is a serious risk factor, it's also one of the most manageable ones with lifestyle changes and medications. Start by limiting your salt intake and adopting a Mediterranean diet pattern. Eat more potassium-rich foods like dairy, beans, avocados, bananas, sweet potatoes, and leafy greens to counteract the effect of salt. However, your potassium intake should be monitored under medical supervision, especially if you already have CKD. Exercise more and try to manage your stress and weight. Your doctor might prescribe ACE inhibitors or ARBs, which help lower blood pressure and reduce protein in the urine. 4. People with family history. Researchers have found certain gene changes that can lead to chronic or cystic kidney disease. So, if a close relative has one of these conditions, your chances of developing similar kidney issues can be higher. A 2009 U.S. study of over 23,000 dialysis patients found that about 23% of participants had close relatives with ESRD. Those with multiple affected family members face heightened risk. The risk is also substantially elevated for those who have a family history of both kidney disease and associated conditions like diabetes or hypertension. If kidney disease runs in your family, regular screenings are crucial. Discuss with your doctor on when to start screening. Genetic counseling can also provide valuable insights into inheritance patterns and help develop personalized prevention strategies. Lifestyle changes can greatly affect genetic predisposition, potentially delaying or preventing disease onset, even in those with genetic risk factors. Try to maintain a healthy weight and optimal blood pressure and glucose levels, exercise regularly, and eat less sodium or processed foods. 5. People with heart disease. Heart disease and kidney disease are closely linked, with one condition often exacerbating the other. Heart disease, particularly chronic conditions like heart failure or coronary artery disease, can cause reduced blood pressure and poor kidney blood flow. A study of 6,759 Japanese participants found that those with higher heart rates experienced a faster decline in kidney function. For each increase in heart rate, the risk of developing CKD and proteinuria increased by 10% and 20% respectively. This risk is especially pronounced in middle-aged or older adults or those with severe heart failure, unstable cardiac conditions, or multiple cardiovascular complications. For kidney protection in those with heart disease, maintaining stable cardiac output and blood pressure is essential. Regular monitoring should include blood pressure measurements, heart rate tracking, and periodic kidney function tests such as eGFR and proteinuria tests. A vital consideration for people with heart disease is the careful balance of medications. Some heart disease medications, like spironolactone, can affect kidney function, so it's essential to have regular checkups and adjust dosages if needed. Make sure you stay connected with both your cardiologist and nephrologist to keep both your heart and kidneys in check. To keep these two organs healthy, the most important thing is to stay active. Choose exercises that match your cardiac capacity, with a focus on low to moderate intensity. Combining the DASH and Mediterranean diets can also be really helpful. These diets emphasize antioxidant-rich natural foods like whole grains, lean proteins, and plant-based foods that are gentle on your kidneys, while keeping an eye on potassium, sodium, and phosphorus. And don't forget omega-3 fatty acids from fish oils. In clinical studies, participants who took fish oil had a 59% lower risk of experiencing cardiovascular events, such as heart attacks or strokes, compared to those given a placebo. The blood pressure of those consuming fish oil also decreased, while that of the placebo group increased. The American Heart Association, AHA guidelines suggest a daily intake of about 1 gram of EPA and DHA in advanced CKD. The safety of this dosage is great, with only minor gastrointestinal side effects like nausea or a fishy aftertaste. 6. Obese individuals. Compared to a healthy BMI of 25, your risk of declining kidney function jumps by 18% at a BMI of 30, soars to 69% at BMI 35, and more than doubles at BMI 40. This is the data from a meta-analysis of 39 studies involving more than 5 million Americans. Even more concerning, in the US, research shows that for every 1 kilogram per square meter increase in BMI, equivalent to gaining 2 to 4 kilograms of body weight, the likelihood of developing hypertension rises by 6.8%, and the risk of diabetes increases by 8.6%. Where you carry your weight matters more than just the number on the scale. The belly fat, or visceral fat around your organs, is especially problematic compared to fat elsewhere on your body. Visceral fat increases physical pressure on your kidneys and releases harmful substances like cytokines and leptin, causing inflammation and further kidney damage. The good news is that weight loss can be transformative. A 2021 study of over 6,700 adults showed that participants in a weight loss program had a 40% lower risk of severe kidney problems and were 92% more likely to see improved kidney function compared to those who didn't participate. Focus on gradual, sustainable weight loss through regular low-impact physical activity and a balanced diet rich in fruits and vegetables. Remember, even modest weight loss can have significant benefits. It's not about achieving a perfect BMI, but about making consistent, healthy choices that protect your kidneys over time. Plus, visceral fat burning should be a focus. Try to keep your waist circumference under 31.5 inches, or 80 centimeters. 7. Heavy salt, sugar, and protein eaters. If you regularly enjoy salty snacks, sugary treats, and protein-heavy meals, your kidneys might be working overtime. High salt or sodium intake not only raises blood pressure, but also directly damages your kidneys by increasing pressure in their filtering units, triggering proteinuria and promoting scarring and inflammation. Speaking of protein, excessive intake can lead to harmful nitrogenous waste. Eating too much protein also forces your kidneys to increase their filtration rate, or hyperfiltration, potentially leading to long-term damage. High sugar intake compounds these risks by potentially leading to diabetes, hypertension, and obesity, The three major risk factors for kidney disease. Excess sugar also increases oxidative stress and inflammation. Those who regularly consume processed foods, which often combine high levels of salt, sugar, and protein, are particularly at risk due to the cumulative effect on their kidneys. So the simplest way to reduce and control your intake is cooking at home with whole and natural foods. Aim to keep your daily sodium intake under 2,300 milligrams, limit added sugars to less than 25 grams for women and 36 grams for men, and consume protein in moderation, about 0.8 grams per kilogram of body weight. For CKD patients, the 2020 KDOQI guidelines recommend 0.55 to 0.60 grams per kilograms of body weight per day of protein. Remember, you don't have to completely eliminate these nutrients, especially protein. Just be mindful of their quantities in your diet. One interesting and simple approach to do so is adopting the Mediterranean diet, which emphasizes fruits, vegetables, whole grains, and lean proteins with moderate animal product intake while being naturally low in sodium and sugar. This diet not only benefits kidney health, but also improves blood pressure, diabetes, obesity, and cardiovascular health. Even better, this eating style can be adapted for any stage of kidney disease, with restrictions only needed if specific lab values become abnormal. 8. Smokers or heavy alcohol users. Smoking damages the kidneys through increased oxidative stress and chronic inflammation, which impair their ability to filter waste. It also constricts blood vessels, reducing kidney blood flow and worsening the existing damage over time. A 2013 study in Nature found that for every additional 5 cigarettes smoked per day, serum creatinine levels, a marker of kidney dysfunction, increased by 31%. Heavy alcohol use contributes to CKD by elevating blood pressure, damaging the heart, and causing liver dysfunction, all of which strain kidney function. Your liver can only process small amounts of alcohol. The excess can weaken your immune system and cause dehydration, worsening kidney damage. However, studies on how alcohol affects your kidneys don't always agree. Some suggest that light to moderate drinking might be beneficial for kidneys. This may be due to the complexity of the way people drink, bioactive compounds in wine, or differences in how studies are done. Still, alcohol isn't recommended because it comes with too many risks. Even small amounts can raise your risk of death, and for many CKD patients dealing with other serious health issues like diabetes or heart disease, drinking could be even more dangerous. So, the best kidney protection strategy is cessation. Our kidneys have some capacity to heal after damage, particularly when the stressors, like smoking or heavy drinking, are removed. It starts with making positive changes. Consider joining a smoking cessation program or rehab club, or tracking your intake with a journal or smartphone app. Staying hydrated and avoiding binge drinking are critical steps for alcohol users. For women, stick to 1 drink a day, and for men, 2 is the limit. A drink means about 14 grams of pure alcohol, which equals 12 ounces, or 355 milliliters, of regular beer, 5 ounces, or 148 milliliters, of wine, or 1.5 ounces, or 44 milliliters, of spirits like vodka or gin. It's so easy to load up on antioxidants from fruits and vegetables, so don't take the risks of alcohol for a few beneficial compounds when nature's superfoods have you covered. 9. People of specific races and ethnicities. Certain racial and ethnic groups are at a significantly higher risk of developing CKD, and this disparity is rooted in a combination of genetic and socioeconomic factors. African Americans, in particular, are 4 to 5 times more likely to develop kidney disease compared to other American groups. Scientists have discovered that people of African descent can carry specific genetic variations in what's called the ApoL1 gene. Having these variations can increase the risk by up to 10 times for certain types of kidney failure. In fact, over 1/3 of U.S. kidney failure patients are African American. Hispanic Americans face about 1.5 times higher rate of ESRD than non-Hispanic Americans, although their overall prevalence of CKD is similar or slightly lower than non-Hispanic ones. Hispanics also have higher rates of obesity, diabetes, and CKD-related complications. Additionally, Asian Americans, Native Americans, particularly those from the Pima and Zuni tribes, and Pacific Islanders experience diabetes, the leading cause of CKD, more often than whites. So, if you are African American, Hispanic, Native Americans, Pacific Islanders, or Asian American, your risk for kidney disease can be higher. Regular checkups can help catch it early and prevent it from worsening. Try to maintain good blood sugar control. 10. People in polluted areas. Several studies have linked long-term exposure to PM 2.5, which are small airborne particles with a diameter of 2.5 micrometers or smaller, with an increased risk of CKD. In a 2024 meta-analysis of 22 studies with almost 8 million people, researchers found that for every 10 micrograms per cubic meter increase in PM 2.5, the risk of CKD went up by 31%. Even short-term exposure to air pollutants like PM 2.5, NO2, and SO2 can contribute to kidney disease deaths, according to a 2023 study with over 100,000 people in China. For every 10 micrograms per cubic meter increase in pollution, kidney disease deaths rose by 0.49% for PM 2.5, 1.26% for NO2, and 2.9% for SO2. Besides the risk from air pollution, exposure to heavy metals at high levels like lead and cadmium can harm the kidneys, especially in people with hypertension or diabetes. In a 2024 study with more than 55,000 participants, even low blood levels of cadmium and lead were strongly linked to increased cases of CKD. Those with the highest levels of cadmium exposure were 5.54 times more likely to develop CKD than those with the lowest cadmium exposure. Pollution hits certain groups harder: outdoor workers, children, elderly residents, and people with pre-existing respiratory conditions. The risk is also particularly heightened for those living near industrial zones or high-traffic areas, where exposure to both air pollutants and heavy metals is more common. It's helpful to track the Air Quality Index, or AQI for short, in your area. The AirNow website, run by the U.S. Environmental Protection Agency, or EPA for short, lets you see your local AQI. Aim to limit your time outside when the AQI is higher than 50, and keep windows closed during peak pollution hours. Using an air purifier with a HEPA filter at home can also help keep your indoor air clean. Consider wearing N95 masks during high pollution days, especially during outdoor activities. Stay well hydrated, as this helps your kidneys flush out toxins more effectively. Bring more plants into your home. Plants like croton, dumb cane, lady palm, peace lily, rubber tree, English ivy, and spider plants are especially good at filtering out pollutants. You've learned about the high-risk groups for kidney disease. If you're in one, it's something to consider. More than 1 in 7 American adults have CKD, but 9 out of 10 don't realize it. So, how can you find out if you have CKD? The answer is simple. Common lab tests that you can do anytime. They're easy, convenient, and could make a life-changing difference. Tests to detect kidney disease. Catching kidney disease early can make a big difference in managing it. Your doctor has several tests to check how your kidneys are doing and spot problems before they get worse. One key test measures creatinine, a waste product in your blood. The GFR shows how well your kidneys are cleaning your blood. If your creatinine levels are high and your GFR stays low, your doctor will likely diagnose you with kidney disease. Another test checks for urea nitrogen in your blood. High levels of urea nitrogen in your blood can mean your kidneys aren't clearing waste as they should. Your doctor might also test your urine for protein, a condition called proteinuria. Healthy kidneys let only a tiny amount of protein into your urine, so if there's more protein than normal, it's a sign your kidneys aren't working properly. An ultrasound, which uses sound waves to create pictures of your kidneys, is another helpful tool. It can spot structural issues or problems with blood flow to your kidneys, helping identify if you're at risk for kidney disease. These tests are simple steps that can give you and your doctor the information needed to take care of your kidneys. Conclusion. The key message from today's video is that recognizing and understanding the signs of CKD and ESKD can truly transform your quality of life. CKD often flies under the radar with no obvious symptoms, which means it's frequently caught late, raising the chances of complications and worsening health. Complications of CKD include a buildup of fluids and toxins, high blood pressure, electrolyte imbalances, anemia, heart problems, and weakened bones due to low calcium and vitamin D levels. These issues bring on symptoms like fatigue, muscle cramps, loss of appetite, a metallic taste in your mouth, nausea, vomiting, weight loss, swelling around your eyes, legs, or feet, shortness of breath, trouble focusing, confusion, and even changes in your skin. Your skin might give clues about kidney trouble through intense itching, rashes, blisters, or calcium buildup in blood vessels or skin. You might also notice dry skin, swelling, changes in skin color, or issues with your nails and hair. Early red flags for CKD include foamy or bloody urine, needing to urinate at night, urinating less often, or pain in your side. If you spot any of these signs, don't wait. Reach out to a doctor right away. Blood and urine tests can confirm what's going on and guide you toward the right care, often with a kidney specialist or nephrologist and a dermatologist working together to support you. Beyond knowing the symptoms, it's important to be aware of risk factors that make CKD more likely. The biggest risks come with diabetes and high blood pressure, especially if you're over 60, obese, have heart issues, a history of acute kidney injury, or a family history of kidney problems. Living in an area where CKD is common or being exposed to certain environmental factors can also increase your risk. While you can't change things like age or family history, you can take charge of many other factors. Choosing a healthy lifestyle and getting regular checkups are powerful ways to lower your risk of developing CKD or slowing its progression to kidney failure, which might require dialysis. Make it a habit to get screened yearly with tests for urine protein, GFR, and blood creatinine levels. Staying closely connected with your kidney specialist is vital. Follow their guidance on treatments, medications, dialysis if needed, and lifestyle tweaks. Simple changes like adjusting your diet or habits can have a huge impact on your health. By staying informed and proactive, you're taking meaningful steps to manage kidney disease and boost your overall well-being. We hope this information empowers you or your loved ones to tackle kidney disease head-on. Share these insights with friends and family, especially those at higher risk, to spread awareness and encourage early detection. Together, we can help prevent the serious effects of kidney disease. Be sure to check out our other videos for practical tips on lifestyle and dietary changes to support kidney health. You'll find advice on foods to avoid, ones to embrace, and how small adjustments can make a big difference. Don't miss out on these helpful resources. Stay informed, stay healthy.